对，那个我那个是只要沾了我用了，我没有协议，他那个属于什么事儿，把那给别的，比如我给那个那没关系，人家要了。他转发没？转发就不管了。他想把你照片单独发公众号，公众号有用，其实他那根本就也没人看，但是我们有协议。有协议。
Friends of the media, good afternoon. Welcome to the press conference of the Joint Prevention and Control Mechanism of the State Council. Today, we will focus on law-based prevention of imported cases. We have with us Inspector Madam Wang Bing from the Disease Control Bureau of National Health Commission, DDG Song Yueqian from the Health Quarantine Department of GAAC, Director General Liu Haitao from the Border Inspection Department of National Immigration Administration, DDG Han Guangzu from the Flight Standards Department of CAAC, Chief Epidemiologist Mr. Wu Zhunyou from CDC. To take questions on prevention and control at points of entry, crew check, and quarantine in collaboration with neighboring countries and measures on international flights. First, some updates on the pandemic. In the 24 hours of April the 26th, according to reports from provinces, cities, and Xinjiang Production Construction Corp., newly reported confirmed cases 3, including 2 imported cases, 1 in Jilin Province and 1 in Guangdong Province. 1 newly reported confirmed case was domestic case. In Heilongjiang Province, there was no new death. New suspected cases 5, including 4 imported cases and 1 domestic case in Beijing. On the day, newly cured and discharged from hospitals 80. Close contacts that were removed from medical observation 508. Severe cases was increased by 1. Updates on the front of imported cases. Remaining confirmed imported cases 627, including 22 severe cases. Remaining suspected cases 7. Cumulatively confirmed imported cases 1,636. Cumulatively cured and discharged from hospitals 109. There was no death among imported cases as of 24 o'clock April the 26th, according to reports from provinces, cities, and Xinjiang Production Construction Corp. Remaining confirmed cases 723, including 52 severe cases. Cumulatively cured and discharged from hospitals 77,474. Cumulative deaths 4,633. Cumulatively reported confirmed cases 82,830. Remaining suspected cases 10. Cumulatively traced close contacts 730,529. Close contacts that remained under medical observation, 8,443. In Hubei province, on the day there was no new confirmed case, no new suspected cases. Newly cured and discharged from hospitals 12, all were Wuhan cases. There was no new death. Cumulatively cured and discharged from hospital in the province 63,616, including 46,464 from Wuhan. Cumulative deaths in the province 4,512, including 3,869 in Wuhan. Cumulatively confirmed cases in the province 68,128, including 50,333 in Wuhan. According to reports from provinces, cities, and Xinjiang Production Construction Corp, new asymptomatic infections 25, including one imported asymptomatic infection. On the day, none of them were transferred to the group of confirmed cases. On the day, 51 were removed from medical observation, including 21 imported asymptomatic infections. Asymptomatic infections that remained under medical observation, 974, including 131 imported asymptomatic infections. From Hong Kong, Macau, and Taiwan, cumulatively reported confirmed cases 1,511, including 1,037 in the Hong Kong SAR, 45 in the Macau SAR, and 429 in the Taiwan region. On 26th of April, for the first time, there was no remaining confirmed, no suspected case in Hubei province. Domestic cases in the country have been brought under 100 imported cases, among which cured and discharged from hospitals exceeded 1,000 cases. We have made a milestone success. Those who remain under medical observation as asymptomatic infections are still nearly 1,000. We need to expand the testing scope. Those who should be tested must be tested. This has been the updates on the pandemic. Now we'd like to take questions. Please ask questions on today's topic, and please identify yourself before you ask your questions. Journalist from the first row on the left side, the journalist near the aisle, please. Thank you. With the Xinmin Evening News, recently we've noticed that in many places there have been cases triggered by or related to imported cases. How many of the cases are related to imported cases? What are their features? Their occurrence has shown some weaknesses, and what are the measures adopted to make up the weaknesses? I'd like to ask Inspector Wang Bin to take the question. Since the 21st of March, across the country, 107 cases were reported as related to imported cases. These related cases accounted for 88.4% of the total domestic cases. There are several features. First, there is a clear close contact history or common exposure history. Second, they are distributed in border cities and provinces or coastal cities and provinces. Third, most of the cases occurred in families. So these are the distinctive features of these related cases. We have been focusing on the point of entry to the door of families. We have a closed loop management. Any step out of the cycle or the link may lead to unexpected results. Therefore, these related cases have provided us with valuable reminders. First, In the early stage of prevention against imported cases, we didn't have 14 days of mass quarantine or medical observation on all the imported cases. That led to the failure in identifying all potential cases or hidden cases. Second, in some places, there has been slackened efforts. People didn't keep unrelenting focus on the self-safeguards or self-protection. That was reason number 2. Third, in our epidemiological survey, we felt that there were some confirmed cases who indeed intentionally hid their history of travel or history of the confirmed cases. And that led to great difficulties in our epidemiological work. That led us to believe we must keep unrelenting focus on prevention and control measures. In reviewing these reasons, we found we need to improve the capacity of fever clinics in identifying the cases at the early stage. Hospitals need to improve their management over nosocomial infection prevention and improve management accordingly. In light of the previously occurred clustered cases and related cases, the Joint Prevention and Control Mechanism have reported cluster cases to provinces, autonomous regions, and the local Joint Prevention and Control Mechanism and commanding centers. In our circulated notices, we put forward the following requirements. First, we must improve the prevention against the imported cases for all the inbound travelers. We must have 14 days of mass quarantine and medical observation.
Also, we need to emphasize the efforts in all the stakeholders, like the customs, the border control, and etc., to ensure the closed-loop management. Also, we are to implement 4 measures and the monitoring at the fever clinics as well as the infectious disease reporting. We need to expand the monitoring scope and ensure that the close contacts, the asymptomatic infections, the inbound travelers, and the people in key sectors and in key institutions should be put under monitoring so that we can ensure the measures are in place. Also, we are to ensure the closed-loop management of the communities. Once there's a case of such community infection or cluster, we can quickly identify the reasons and curb the spread. Also, in implementing these prevention and control measures, we are constantly emphasizing the responsibilities and accountability of the local governments and the relevant stakeholders as well as the individuals. We need to strengthen the prevention and control in the various venues and the hospitals and also to strengthen the protection awareness. Okay, let's continue. On the right, on the front row, the second lady reporter, please. Thank you. With CCTV, recently, the 6 ministries jointly worked out a policy circular, which is about the management of the international ship crews and also to protect their legitimate rights and interests. So my question is, what are the latest updates concerning the management of these crews and also to prevent the potential spread by sea? What are the measures adopted? We will have DG Song to take the question. Thank you for your question. Transportation by sea is one of the key pillars of international transportation. To ensure the safety and the health of the ship sailors has become the priority. The GACC has emphasized the pandemic response and guard against the potential spread of the pandemic by sea. And also, we wish to ensure the legitimate rights and interests of the sailors. First, we wish to have very good assessment prior to the arrival of the international ships. Within 24 hours of the arrival, we are to collect the relevant information and conduct risk assessment on all the inbound ships and vehicles or conveyances. And also for cases of fever or dry cough, they will be identified as high risks and will be assessed as the priority. And also we will have the 100% onboard inspection. And the second is about control. That is to strengthen the control and inspection on the arriving vehicles or ships. For ships with the risk of potential spread, we will have the emergency response measures to guard against the potential spread. For quarantined ships and sailors, we will take follow-up measures. And furthermore, we will guard against any potential on-board or off-board by the unnecessary personnel. And also, we try to prevent the unnecessary contacts. So, for people such as the reloading staff, we will adopt a targeted approach. And the third is about management. We focus on the sailors and ensure the closed-loop management. During the stay in China, the captains of the international ships will be held accountable to realize the closed-loop management on the ships. And also, monitoring will be strengthened to identify any potential risks. And also for any international sailors who are off-board, they will take the NAT test 100%. Furthermore, the health quarantine measures will be conducted by GACC before the international sailors are on board again. Also, for vehicles which apply to transfer from the international routes to domestic routes, then there must be quarantine measures adopted and taken before they are given the approval. Also, we have worked jointly with the Joint Control and Prevention Mechanism and shared the relevant information among the stakeholders and conduct a unified and consistent approach for the sailors' quarantine management and etc. We wish to realize the seamless connection and the closed-loop management. Thank you. Thank you. Let's continue. Okay, on the right, on the second row, the third lady reporter, please. Thank you. With China Civil Aviation news. So how about the current operation of the international flights? Also, by April the 22nd, 20 flights have been sent to bring back the Chinese overseas. How about the operation? We will have DG Han to take the question. Thank you for your question. CAAC already worked out a policy notice requesting that starting from March the 29th, further reducing the number of international flights and adopting the pandemic response measures. By April the 26th, the Air China and the Eastern Airline, etc., altogether 19 domestic airlines and 24 international airlines have executed international flights to and fro 36 countries in the world, and we have conducted 417 flights and sent more than 82,000 passengers. With these flights, the daily passenger volume is about 3,000 people. Last week, CAAC altogether arranged 4 flights to bring back Chinese overseas from United States, UK, and Italy. Altogether, more than 850 Chinese overseas, including more than 700 Chinese students studying abroad. And this week, CAAC is planning, together with the related ministries, to have 5 flights to bring home about 900 Chinese overseas from United States and other countries. Most of them are Chinese students studying abroad. CAAC will continue to implement the State Council, in particular the Joint Control and Prevention Mechanisms instruction, and show care and love to the Chinese nationals living and studying abroad. And also, we will make temporary flights to go to the severely affected countries and regions to bring back Chinese nationals. These temporary flights are ad hoc ones. They are extra ones. The 5-1 policy is designed to guard against the potential international spread of the pandemic. So the added ad hoc flights do not affect the current regular flights. Okay, let's continue. On the left, on the second row, the second lady reporter, please. Thank you. With CCTV Financial Channel.
Recently, there has been wide attention on the prevention of imported cases from neighboring countries. What has been the measures adopted by NIA with the neighboring countries? I'd like to ask DG Liu Haitao from NIA to take the question. Thank you. During the COVID-19 response, National Immigration Administration has asked the bordering immigration authorities to enhance collaboration with immigration authorities in neighboring countries in the law enforcement and COVID-19 prevention control. More pragmatic efforts have been carried out and progress has been made in the following aspects. First, we've established information sharing mechanism with neighboring countries by video conferences, telecalls, and emails. Altogether, 200 plus bilateral meetings have been arranged. We have been reporting bilaterally the epidemic prevention control efforts, the clearance and prevention control measures. We've helped neighboring countries to jointly improve the COVID-19 response. Second, we have been collaborating with neighboring countries to improve the checks on borders. We helped the immigration border check authorities of neighboring countries to set up columns for information dissemination and the distribution of leaflets to the nationals on both parts of the borders on the latest information of the border clearance and information on prevention control minimize the flow of people and the movement of transportation vehicles. We've been promoting bilateral countries to conduct coordinated efforts in consistent prevention and control measures. Third, we've been collaborating with authorities in neighboring countries to enhance the border patrols and inspections and crack down on the illegal cross-border activities, find clues of violations. We've been jointly cracking down on cross-border crimes. We've been engaged in the coordinated establishment of the rapid vetting processes and repatriation of the illegal border breakers. Fourth, we've improved the experience sharing with the neighboring countries, in particular the inspection and immigration authorities. We regularly exchanged common knowledge of the patrolling and checks so as to jointly improve the prevention and control capacity and jointly curb the transmission of the pandemic across borders. Thank you. Next question, please. Journalist from the third row on the left side, the journalist in black. Thank you. With the cover news. On yesterday's press conference, there was a very inspiring news, which was that in Wuhan, Wuhan reported 0 for all hospitalized COVID-19 patients. Does it mean that all the COVID-19 patients have been discharged in Wuhan? I'd like to ask Chief Epidemiologist Wu Zunyu to take the question. Thank you for your question. That's a great question. It has some twisted in this question. Reporting 0 doesn't mean all the patients have been discharged from hospitals. By reporting 0, we mean those confirmed cases are no longer registered. But it doesn't mean that all the COVID-19 patients have been discharged from hospitals. First, what is the criteria for hospital discharge? After treatment, the patients are on recovery and rehabilitation. Once they are up to the following criteria, they can be discharged. First, temperature has to be back to normal for 3 consecutive days. Respiratory symptoms have been alleviated or even disappear. Image checks, including the CTs and X-ray checks, have shown no inflammation. The sputum collection and the throat swab has shown 2 consecutive NAT negative results. And these are up to the discharging criteria, and the patients up to the standards don't have to be hospitalized. They can go to communities for quarantine and further medical observation. We've noticed that prior to catching COVID-19, there were also patients with underlying diseases such as hypertension, diabetes, or cardiovascular diseases, or chronic kidney diseases, renal diseases. With the treatment of COVID-19 doesn't mean they are also cured with the underlying diseases. Some of the patients need further treatment, and some may have developed comorbidities during the treatment of COVID-19. For patients like this, even COVID-19 test has shown a negative NAT test result. They have to stay further in the hospitals for the treatment of comorbidities, combinations, and underlying diseases. Thank you. Next question, please. Journalist from the 4th row on the left side, the journalist near the aisle. Thank you. With the Phoenix TV, reports said that in countries with severe cases accused China, that China may have already known the first batch of COVID-19 patients back in the mid of December last year, but we failed to report to WHO. So what has been our response? Again, I'd like to ask Chief Epidemiologist Wu Zunyu to take the question. Thank you for your question. There has been discussion on this very issue. China's health authority has been following the principle of transparency, openness, and a sense of responsibility. We have been disclosing our information, sharing experiences, and promoting international collaboration. I'd like to summarize our principled position in 3 ones. First, we reported and the information and informed the WHO as soon as we got the information. And the second one was that we timely shared the genome sequence of COVID-19 virus the first time we got it. Third, we promoted international cooperation at the earliest stage possible. Let's trace back to the short history. After the COVID-19 broke out in April, in late December, the health authority in Wuhan at the end of December last year issued a notice on improving observation over atypical pneumonia. You may have noticed that in a TCM hospital in Hubei, a doctor named Zhang Jike during his diagnosis found 3 suspicious atypical pneumonia patients and reported it to the health authority in Wuhan. And the health authority in Wuhan found it important and asked other hospitals to proactively collect similar cases. After the notice was given on 31st of December, National Health Commission and the CDC sent an expert panel to assist further investigation in Wuhan to learn further about the outbreak. On January the 3rd, despite the fact we didn't know the exact reason, we reported the atypical pneumonia to WHO. At the first time the information was available to us, we also reported it to United States and other countries. And starting from January the 3rd, we also reported our prevention and control and study and research on the virus. CDC director from both China and United States had a video conference on 12th the 31st. We told them that we have found these atypical pneumonia. We looked at the possibilities of joint research. On January the 9th, we successfully separated the genome sequencing and we confirmed that the coronavirus was a major pathogen for causing the disease. So on January the 9th, the date on which we found the information, we reported this to WHO and shared it with other countries.
Then on January the 12th, the genetic sequence was shared with WHO. Also, at the same time, we submitted the genetic sequence to the global influenza database. That means this is, for the influenza database, this is an internationally shared platform. So with the genetic sequence information available, the world is now able to study and develop the vaccines against the coronavirus. So this is the biggest contribution made by China to the whole world. And then on January the 25th, we had the on-site visit to Wuhan. And then from February the 12th to February the 16th, we had the joint mission from WHO and China, and I had the honor to be one of the one of the expert team members. The team visited Beijing, Sichuan, and Guangdong, as well as Hubei, Wuhan. In this team, and there are experts from all over the world, including US. And then on March the 23rd, US embassy representatives took part in the international experience sharing organized by NHC. And then on March the 25th, China CDC and the US CDC once again held a video conference exchanging experience in pandemic response. So with this timeline, you can see clearly that China's response to COVID-19 has been open, transparent, timely, and responsible. Faced with the global spread of the COVID-19, countries in the world should uphold the principle of respecting science, facts, and solidarity to respond to COVID-19. Only by the national and international solidarity can we enjoy the chance to overcome COVID-19 and control its spread in the world, and can we gradually recover the normal lives and production in the world. Okay, let's continue on the right, on the third row, the first reporter, please. Thank you. With Hong Kong Economic Herald, recently, many flights from different countries come to China to pick up their procurement, and they need to stay overnight to take a break. And also, the same is true with the Chinese crew members. So, what are the measures adopted to reduce the risk of pandemic spread? We will have DG Han to take the question. Thank you for your question. To deal with and prevent the potential international spread of COVID-19 and ensure the unfettered flow of movement, the CAC has worked out policy notice in this regard. We have optimized the control measures for the movement of cargo and crew. There have been specific requirements. For domestic crew members, when they are abroad, they should stay in the designated place, and they should not go outside. They should not go to the public sites and nor use the public facilities like the gyms. Apart from staying in the room to take the rest and have meals, the crew members should always face masks. They should not go outside, and they should try to minimize the exposure to the potential spread of COVID-19. For international crew members in China, the airports are requested to provide designated places for them to take a break. If the conditions are not available, the international crew members should be arranged to the specific hotels, and they should be provided with shuttle buses to and from the airport and the hotel. Also, there should be concentrated quarantine, and with above-mentioned measures, we wish to minimize the potential exposure to COVID-19 or the potential risk of the spread of the disease. Okay, let's continue. On the right, on the third row, the lady reporter, please. Thank you. With Shenzhen TV, recently, in South Asia, the pandemic is on the rise, and there are more than 20,000 cases in India and also more than 4,000 cases in other South Asian countries. Will they affect the pandemic response in China? And also, what are the measures adopted by Southwest China to guard against the potential importation? We will have Madam Wang to take the question. Thank you for your question. Just as you pointed out, in China, we do enjoy a very long borderline. For the borderline on land, we have more than 29,000 kilometers of border. And in particular, in Southeast Asia, the outbound and inbound travelers account for more than 80% of the national total. So with such a long borderline, we are faced with a very high risk of potential importation. Also, in Southeast China, the land is sparse. It is sparsely populated, and the health capacity, such as the laboratory diagnostic capacity, is inadequate. Faced with the major outbreak of COVID-19, we acknowledge the weaknesses. Just as you have mentioned, there's a high risk of importation of COVID-19 in Southeast Asia. That's why on April the 21st, we have sent a working team composing 16 experts to go to the southeast part of the country and offer on-site guidance, helping the localities to work out response plans. The current principle is that we will adopt tailored measures and tailored approaches for each entry point, and the local authorities will be held accountable for the implementation of these measures. Specifically, we have adopted the following measures. The first is to ensure the local authorities should be held accountable for the responsibilities. At the moment, the border provinces and the entry points have already identified such prevention as the priority, and they have fulfilled their duties. They have strengthened the intra-provincial or intra-municipal resource allocation and arrangement. They have also tried their best to equip themselves with better resources. And secondly, we can see that in the border provinces, within the province, to arrange and dispatch the supplies is only one part of the task. We are also helping these localities from the central government level to equip them with appropriate resources and improve the capacity building, such as conducting training programs. We hope that we can help them to be better equipped with the capacity to identify and to treat the potential cases of COVID-19. And thirdly,
at the national level, we've been coordinating with other departments to ensure lab testing equipment and protective gears and other supplies are in place to ensure in the mobile hospitals, in the camping hospitals and designated hospitals and quarantine venues are well equipped with the capacities. Only with these well-conditioned capacities can we ensure that the prevention and control capacity of the border cities are under our control. Down the road, we will continue to focus on the implementation of the efforts in these border cities and counties. We will monitor the progress of implementation, identify the weaknesses, and make improvement accordingly. We will continue to provide guidance to the implementation of the measures in the southeastern border cities so as to prevent against the imported cases from Southeast Asian countries. Two last questions. Journalist from the fifth row on the left side. The third journalist, please. With China Education TV, it was reported that along the borders with other countries, we may have artificial and natural barriers such as the field ridges. What are the measures adopted by NIA to enhance border control? I'd like to ask DG Liu Haitao to take the question. Thank you for your question. As you have rightly pointed out, along the land borders in our country with adjacent countries, there are very complex terrains. We have mountains, the ferry lanes, and the shortcuts, field ridges. Sometimes a border may be represented only by a line of field ridges, which constitutes the border between China and adjacent country. Indeed, this has put forward high requirement on our border prevention and control. In particular, the citizens living on borders have been living there for generations, and many travel back and forth between China and neighboring countries. There has been very close communication among citizens living on borders that has put forward even higher challenges on our prevention and control. Therefore, NIA has been guiding the border immigration authorities to improve the joint prevention and control carried out by the party committee, the military, and the police to improve the mass prevention and control to ensure a safe and good order of the border movement of people. We've enhanced the law enforcement and the checks at the border area. Under the leadership of the party committee, we've set up the risk control senators. We've been leveraging the role of the villagers and the party committee members to be engaged in mass prevention and control to enhance our inspection of the border areas and crack down on the illegal border breaking activities. We've also reallocated the police teams for the ferry lanes or the mountain ridges where there have been frequent illegal violations. We've enhanced the patrolling to strictly crack down on the illegal trafficking, the drug trafficking, smuggling, and other crimes. Recently, immigration authority have found some organized crimes of trafficking and smuggling. Third, we've been leveraging the use of modern technology and equipment. We used video camera monitoring and the drones or unmanned aerial vehicles to enhance the border area inspection to minimize the blind corners that have been left unattended, so as to improve the efficient monitoring and have some intelligent alarming. Fourth, we've organized the citizens along the borders to be engaged in mass prevention and control. Wide dissemination of prevention and control information and the laws and regulations related to border control have been effective in reminding the citizens on borders not to hide the illegal activities, not to conceal the lawbreakers, and for those who have been disclosing the criminals and the crimes, they will be incentivized. Thus, we have mobilized the professionals and the mass citizens to safeguard the safety along the borders. Thank you. The last question for the day. Journalist from the fourth row on the right side. Third journalist, please. Thank you. With the CCTV, the Society and Law Channel, the pandemic has exerted impact on the aviation industry. Government has taken active response. In the previous press conference, GAAC has given us introduction on the inspection of the crew members for passenger flights. Will this be rolled out to the crew members along the cargo flights? I'd like to ask DDG Song Yuetian to take the last question. Thank you for your question. Safeguarding the smooth international airline routes have been important to promote economic and social development. GAAC has been collaborating with other ministries to ensure the smooth flights. Last week, 6 ministries and departments jointly issued a notice on precise prevention and control on the cargo, freight, and flight crew members. More specific measures have been adopted this week to have a consistent measure and consistent parameters and standards. We have a closed-loop management over key steps, mainly 2 steps. One is domestic crew members when they are in international territory, and the second situation is international flight crew members have gathered in China's airports. We require all the crew members to have a point-to-point specialized and designated transportation by transportation vehicle. We will have a closed-loop management, more improved management to minimize the transmission risks. Second, we precisely carry out the inbound crew members quarantine and inspection for all the international crew members. They must truthfully file in their health declaration and collaborate with the customs authority to go through the temperature monitoring and health quarantine. For domestic crew members and international crew members, we have precise categorization and strict management. For domestic crew members, if they are on cargo flights, there are no passengers, so there is no likelihood of cluster cases triggered by the infected passengers. They stay in international airport for only a short period of time. After they come back to China, if they are found normal by customs checks, they don't have to go through NAT tests. And for the crew members who have stayed over in international airports, GAC require NAT tests to be conducted on all these passengers for all these crew members. For crew members on passenger flights, there is the likelihood of cluster cases. So for the crew members, after they come back to China, they have to go through NAT tests. Second, for the international crew members who have come to China, if they go through direct flights from other countries to China and will go on direct flights to other cities, they have to take NAT tests at the first point of entry. If the results are negative, they can continue with the direct flights further on to other cities. International airline companies, after their crew members have come to China, they will not leave the apron of the airports after they get the normal test from customs and show normal. They don't have to go through NAT and can fly out. The NAT test positive results for crew members as such, if they want to go back to their countries to get treatment after approval by the Joint Prevention and Control Mechanism, they can leave China and go back to their original country. Third, we strictly implement the prevention and control obligations. All the related authorities and Joint Prevention and Control authorities at all levels must fulfill their obligations in good faith to ensure all the measures are well implemented. Thank you.
Thank you. So, during today's press conference, we have speakers talking about prevention and control based on law and the guard against the overseas importation. For tomorrow's press conference, we will focus on the rural and agricultural development during the pandemic period. So we will have officials from the agricultural authorities to take questions. We welcome your continued attention, and that's all for today. Thank you.
给我了。